Hi, my name is Matt Birtwistle from FND Hope UK, and welcome to this interview with Dr. Kim Bullock of Stanford University. It was great to be able to interview Dr. Bullock on this topic of the use of virtual reality in the treatment of functional neurological disorders. Dr. Bullock is a thought leader in this area and at the moment is actually conducting a trial with sufferers of FND in America. That trial is actually still open. I will be providing a link in the description below for those of you that might be interested in joining this trial and making your contribution. But the whole area of virtual reality and the use of this technology in supporting the treatment is very, very new. So I thought it was an interesting time to have this conversation, learn a little bit more about how this technology is being used, what type of benefits we can expect to see from the use and application of this technology in the treatment of functional neurological disorders. I'm sure as you watch this, you will probably have many questions, in which case I'd encourage you to leave those questions in the comments below. I can reach back out again to Dr. Bullock and get some follow-up as well if there's sufficient interest in this. So please go ahead, watch the video, like the video, subscribe to our channel so you can get updates as we publish more information. Let me hand over now to Dr. Kim Bullock.
So my name is Kim Bullock, and I'm a board-certified psychiatrist in the U.S. and at Stanford in the outpatient Department of Psychiatry and Behavioral Sciences. So I have a subspecialty in neuropsychiatry and behavioral neurology, as well as lifestyle medicine, and I direct now over the past year the virtual reality and immersive technology program that's we just developed.
Okay, and for us, we're so excited to have you here to obviously to talk about this fascinating area of virtual reality and the impacts and benefits that it can potentially give to treat patients who are suffering with FND. And obviously, it's got wider applications than just FND, but obviously for ourselves, that's where we're interested. So. Just to begin with, just explain to people what virtual reality is from a practical standpoint. And I think, if it is similar, people are probably used to the idea of virtual reality headsets and maybe use Google Cardboard or things like that. Is it the same as that?
Is it what?
Is it the same as that?
Yeah, well, I guess, that's how do you describe it in just a few words? I don't know. It could mean a lot of things. To me, I think of it as a perceptual illusions that take you to another place or allow you to inhabit another body as well. So that's kind of a kind of quick way of describing what virtual reality is. But it's the use of perceptual illusions that are usually computer generated. That's how I think of it. But I probably ask 100 different people what the definition is, and you'll get 100 different answers. But that's kind of the one that sticks with me.
Yeah, and from the practical application of that, as you mentioned, it's computer generated. I guess the use of the VR headsets that people might be familiar with is typically how you're going to engage in this sort of process of virtual reality.
Yeah. And there's been the traditional VR that's been around for like 20 years. That's the headset that just tracks kind of the XYZ axis of your head, and it feeds into what you see. But now, in the last 2 years, why it's on everybody's radar is now that you have the ability to track your body as well. And so that's much more information coming from the real world in there, and it can create these more phenomenal, immersive illusions, like you can have a body transfer experience into another type of body. So that's
so you really feel as though Yeah, you really
Yeah,
feel as though
you're
you're
inside an
getting that.
avatar, or you can
Yeah,
be inside of something. You can be it's a fully more immersive experience than just, kind of seeing, just having your head. Um,
yeah,
so
yeah,
I think that's why it's more, it's on everybody's radar more because of this new and the gaming technology that allowed that. And now, commercially available. You don't need $1 million lab in order to have these kind of simulations. You can do it at home.
yeah. And let's just take it back. So obviously we understand the concept of immersing yourself in an experience such as that, a virtual experience. Um, what's the purpose for doing that? I mean, what's actually happening there in terms of, um, as the individual participating in that situation? Are you distracting yourself from what you would normally feel in a real world environment? What is it that we're actually trying to achieve by utilizing VR?
Oh, yeah, that's a good question. So, well, for behavioral health purposes, I think there's a few different utilities or functions of VR. So, the first one would be something like just distraction itself. So, distraction can allow you to tolerate a lot of things, painful procedures. Um, you can tolerate distress or certain emotions. It gives you a little bit of distance from them. So it is a kind of way to distract. And distraction is something we all do normally, and it just allows you to do that. And then I think the other thing is that whatever you learn in an immersive environment, um, it enhances teaching. So you can teach something and you can have an interactive learning experience. So, like, a lot of behavioral health is actually teaching skills. So you can teach skills like mindfulness or diaphragmatic breathing, and people will retain it longer than if they were just listening to me drone on about something. If they're really in there, and they're taken to another place and they can influence, it's different than watching a TV where you're just very passive. In this, you can actually interact. So it enhances whatever you're teaching. um, the other thing it can do is things like exposure, which is like habituation when to things. So you can another part of behavioral health often involves getting used to things, kind of like allergy shots, where you get a little bit of something that's bothering you over and over until it doesn't bother you anymore.
Yeah,
So if you're afraid of something, um, you could practice getting a little tiny dose of the exactly precise, customized thing that you're afraid of. So you can do that with immersive technology. So you don't have to do it in the real world. Or you can practice it first instead of just practicing it in your imagination, which is what a lot of therapy has been about, is helping people imagine going into this scenario when they leave the office with the dog they're afraid of, let's say. Um, this way they can imagine it, but then they can get even a fuller, more emotionally provocative, real experience by being in an immersive environment and seeing the dog. It's going to feel more real, and they're going to habituate, and that often can help people get to the next step, which is doing it in reality. So it's sort of an augmentation to imagination in a sense. It's
yeah,
kind of between your imagination. And so, yeah, there's I could go into 100 other ways that we use it, but those are kind of the main enhancing education and distraction and exposure and habituation.
okay. So if I think about that from the point of view of obviously some of the symptoms that an FND sufferer would have, um, and if we took pain, for instance, because that's so common among sufferers, and distraction is obviously one way of trying to overcome pain.
Yeah, for the short term. Yeah.
For the short term,
Yes.
exactly. People can have the experience of watching something on the television and laughing about it, and
Yeah.
when they're doing that, they're not feeling any pain because
the body and the mind is distracted. So I'm guessing that some of that immersive approach within VR would allow for that same type of experience to occur.
Yeah, so you're talking about coping.
Yeah.
So, yeah, it can be used for coping with pain. But the other novel use that we're looking into VR to do is using perceptual illusions to change motor and sensory sensations in the brain. And we're just starting to understand this. So the thing that I'm studying in the use is the use of virtual reality to deliver something called mirror therapy, in which you swap your the sides of your body. Like, so when you move your right arm, you actually see your left arm move, and when you move your left arm, you see your right arm move. And there, you can deliver this with just plain mirrors, and that's been done for the last 20 years, and it's been shown to help with all sorts of motor and sensory problems that are on just one side of the body. So if somebody has a problem on just one side of the body, like stroke, weakness, with multiple sclerosis and having sensory symptoms, and it's only occurring on one side of the body, mirror therapy is a very rigorously studied evidence-based intervention for a multitude of one-sided motor and sensory neurological disorders. So we know, so we're just starting to see if we can use this, and the evidence is starting to mount that you can deliver mirror therapy through virtual reality. So that's another use of using it as a perceptual, using that perceptual illusion. It can deliver these sorts of motor and sensory interventions through perceptual illusions. We're also looking at body dysmorphia and body dissatisfaction, and it can the other thing I forgot to tell you is it can, with these more immersive, when you embody an avatar, you can change implicit biases. So you can change your belief system about a characteristic of your body or someone else. So if you inhabit the body of someone of a different demographic, and you feel like what it is to be like them, you're going to change your unconscious bias against them. And we have a lot of data in the social sciences and about that. So it's a way to implicitly reprogram the brain.
Right. Okay.
So you can also implicit reprogramming of all sorts of things through technology.
Okay. Because the thing that I had also kind of gathered from reading some of the papers that you published, and the idea being that obviously once you've immersed yourself into the VR world, then the ability to carry out tasks that in the real world you might have difficulty doing, again because of that distraction, where so movement, which might normally be an issue for you in the real world, you're able to actually do that more freer in the virtual world. And obviously in effect, you're training the brain to get used to the movement, because you're actually, you feel as though you're doing it, basically. I guess is my simple way of describing that. But obviously what you're saying, there's even a lot more that can be done that goes beyond just those simple things. Yeah.
Yes, yes, much more, and we're exploring it.
Okay, so let's talk, because I know you've got the trial that's going on. Do you want to just take us through what that trial is? What's the cohort that you've got there, and what are the specific things that you're actually looking to evidence through that trial?
Yeah, and so I'm halfway through it, and because it's a blinded trial, I don't want to go into too many of the details in case anybody who's listening and actually enrolls in this study. I don't want to compromise the blind, but we're really looking at two concepts. One, we're looking at mirror therapy and seeing if people with one-sided symptoms in FND, whether their symptoms get better by receiving a mirror therapy type of intervention. Since a lot of the areas in the brain that seem to be affected um, in FND patients are also seem to be affected and normalized when you have mirror therapy. So we're looking to see, one, is mirror therapy helpful? And then there's a second component. We're looking at exposure and habituation and seeing if people have certain triggers for their symptoms, whether being exposed to them over and over, they can desensitize
Ah,
using it. So there's kind of two treatment components, but it's a feasibility and safety. We're looking for efficacy, but we don't know. It's very exploratory, is what I'm saying, and I'm trying to be agnostic. Of course, we're putting a lot of resources in it, so we think that there is a good chance that this could be helpful. But we're also scientists, and we have to remain agnostic. I have no idea whether this is going to work, and
yeah,
I have to remain agnostic but hopeful.
yeah.
So so that's basically, so we've got a placebo arm and we have an active arm.
Okay, okay. And that trial is just running this year, isn't it? It finishes this year?
Well, yeah, we'll probably be closing out at the end of this year, but we're about halfway through. But we're recruiting. So.
Oh, okay. So I didn't realize you were still recruiting for that.
Oh
So,
yeah, yeah. So we
so
need. So yeah.
okay. So if anybody is watching this and is interesting, then they can contact you directly, I guess.
Yes, yes. Clinicaltrials.gov also through the US has a site. So it requires 8 sessions and they can be done over 1 month, as short as 1 month, or over 2 months. So it's 8 weeks, anywhere from 4 to 8 weeks, but we require that you have 8 sessions. And then if a person ends up in the control or in the placebo arm, we offer them at the end of the study that they can go into the active arm and receive it. Because we're having people come from far away. And so if, you know,
Yes.
it's be disappointed if they're in the placebo arm, but
yeah. Yeah. No, I can imagine, which is a great thing. And I guess we should mention as well that obviously people would need to travel to you. So it's,
yes, and they would need an assessment and a screening and to see that they qualify. So we have some inclusion and exclusion criteria.
yeah,
But I'm hoping a lot of comorbid. So people with FND, the epidemiology shows that they have some common comorbid psychiatric disorders like PTSD, anxiety disorders, depression, and many of these, and chronic pain, chronic regional,
yeah,
complex regional pain syndromes. And all of those also respond to virtual reality interventions. So there's lots of rooms for applying virtual reality, even just to comorbid psychiatric disorders for people with FND that are well documented and that we know work, that aren't exploratory like what
yeah,
I'm doing.
yeah. And how long before you'll be able to analyze and report the results of the trial?
Um, it depends on, yeah. Well, yeah, depends on how quickly we get the data. And we have some preliminary descriptive analysis. We didn't want to analyze prematurely and bias ourselves.
Yeah, yeah,
But it does look like on the Oxford handicap scale, when we look at just do a graph of people's outcomes, it does look like the active treatment is separating from the placebo. But I don't know. It could be chance. So
yeah.
it's not quantitatively, but it was promising.
Okay, okay.
Yeah.
Well, I won't ask too many questions because I don't want to probe too much and put you in an awkward
Yeah.
position. But I mean, that's great that obviously this is going on. I think it certainly is. It's a fascinating area, and I mean, anything that sort of adds to our knowledge in this area and also gives some effective treatment outcomes, I think has to be
Yeah.
applauded. and that's the key thing. I just wanted to touch on a couple of areas as well that I thought could be relevant to this conversation. One is hypnotherapy, and is there any relationship in terms of obviously the way that a virtual reality environment and an individual acts in that, and hypnotherapy? Because hypnotherapy has obviously been used for many years. We're going back over 100 years, and has a mixed reception amongst people. But are there any similarities between obviously what goes on when somebody is under hypnosis and what's going on within virtual reality?
I think so. And I'm not an expert on hypnosis. I don't even do hypnosis. So, but I know a little bit about it. But yeah, I think hypnosis, you have enhanced attention control. And so when you go into immersive environments, your attention is controlled in a sense.
Yeah.
And it can get you to focus with a kind of laser focus and attention. It's enhanced. So I think in both environments, when you're hypnotized and when you're in VR, your attention goes up and your concentration goes up. I think too, imagery. So so often hypnosis asks you to imagine things and bring yourself to another place.
Yep.
And this is a more passive way of doing hypnosis in a sense, because it creates the image for you, so your imagination doesn't have to do it. So it's an augmentation to your.
Yeah.
It's a lazy hypnosis. Let's say. It doesn't require so much effort.
Yes. Yeah. Okay. Which I think that's fascinating. That some of the outcomes that people may read about in terms of hypnosis, it could be some of the things that could be anticipated from VR.
Yeah, and I find is people often, like with traumatic brain injuries, or some people just can't do hypnosis. They don't, they're not hypnotizable. And so this could perhaps help those people that can't do hypnosis. And there's areas in the probably prefrontal cortex that are involved with your ability to do this, and it could enhance that for some people.
Yeah. Has there been any studies done in terms of imaging of the brain? I suppose it's difficult to do in the virtual reality, just because of all the hardware and everything. But when somebody is in a VR environment, what's the brain activity? Are there different parts of the brain being triggered within that than would normally be experienced in the physical world, or are we still unknown in that?
Yeah, not in behavioral health. I haven't. Yeah, we're still very much on the brink of it, and no. So I am not aware of any studies in which there's been imaging done for a behavioral health intervention. Although VR is being used in neuroimaging studies, even here at Stanford, as to elicit like certain emotions.
Yeah.
And things like that. But the mechanism of VR hasn't been studied, but it's being used to do studies on other things. Okay, does that make sense?
Yeah, no, it does. Because where I'm going with this is I'm just wondering, because obviously neuroplasticity and trying to regain that in terms of movement, which is what obviously physiotherapy treatment is doing within the treatment of FND, whether we can try and make some correlation with the VR world and what's going on there and how that can assist.
Well, we know mirror therapy itself, which is a virtual therapy, really a very basic virtual reality therapy, that's been studied. There's a lot of neuroimaging data which shows that, interestingly, the motor pathway, the M1, it on the same side as where the deficit problem is, strengthens that pathway. And it also increases attention and control in the brain as a whole. And so we have a lot of data on neuroimaging for mirror therapy. So that's where the hope that this neuroplasticity can come about. We know there's a lot of homuncular flexibility, this area of sensory motor cortex strip, um, that you can learn how to use different body parts. Like you can learn to use and control a tail when you're in an avatar. So we've got documentation that people can like learn to be an eight-armed lobster and things like that and control
Wow.
this body. So we know there's plasticity in our motor reprogramming.
Yeah.
There's evidence of that. And with mirror therapy, these changes last. So you can amputate a phantom limb permanently. So there's the hope that we can do something permanently. It's not just a temporary change.
Yeah, and I guess that's obviously people watching this or listening to this will be wanting to hear that it's a long term, isn't it? If we're doing this, is it going to stick? So if I'm having a functional weakness that says I'm not able to move my leg, if I'm in VR and I'm actually doing that, will that then help me in the real world and stick?
Yes, and that's what I'm very interested to find out.
Yeah, yeah. The other question that I wanted to put to you was the relationship of what goes on in terms of VR treatment and how that would be supportive to, say, CBT, because I'm guessing that a lot of ideas and conversations that happen within the CBT therapy can be reinforced by the use of VR. Is that correct?
Yes. So I see. So most of the studies in behavioral health are CBT studies that use VR. So I think of it VR as a tool within CBT.
Yeah.
So it's just like, I have a chair or I have some Kleenex in the room. That's a tool of psychotherapy. And the VR is just another tool that we can use in the room.
Okay, and I'm conscious of time, so I don't want to take up too much more, but I will ask the question that I can hear a lot of people asking me now.
Great.
If I went out and bought a VR handset, would it be, could I use it myself? Could I actually gain any benefit from this? And obviously there's a whole range of, there's VR videos that you can get on iTunes, there's headsets that you can buy relatively cheaply. You can go all the way up to the Oculus Rift, very expensive computer gaming type of environment. But for individuals who might want to dip their own toe in the water and explore VR, is it worthwhile them trying to do that, or as you were saying before, it's a tool within CBT? Are they better off just working with a CBT specialist than maybe trying it within that environment?
Oh, that's a good question. Well, if they're interested in like something like the more exploratory thing, like mirror therapy, unfortunately, there's no commercially available mirror therapy in VR.
Yeah.
But I would really press people who are having unilateral pain or sensory problems to get their team of physicians to order them mirror therapy and try that, because I think it's underutilized and people forget, at least in the States, there's a lot of evidence that it's helpful and it doesn't get used. So I would say don't, there's more bang for your buck to go out and try mirror therapy than to try some gaming console in that regard. And then for exposure therapy, yes, but I think you need to have a clinician help you and customize it and have it be part of your therapy and your homework and your habituation process. But usually people, unless I guess you're doing a self-help book or something and you want to challenge yourself with the triggers and you feel skilled enough to do that, I guess you could, customize and go on YouTube VR 360 and find exactly what your trigger is and help you do that. But usually you need a coach and a mental health provider that's working with you to really get good outcomes to do that. So, but if you want to have fun with it,
Well, that's the other thing. There's
just have fun. Yeah.
there is no fun in FND normally. So to find a treatment that you can actually enjoy it, because it's it's a bit of a blast. I'm sure that, the programs that you're working with, that's part of the experience as well. It's not there to hurt somebody. You can
Right.
actually,
Well, the way we're delivering it though is not fun. Okay, so I
right.
do want to say, so the mirror therapy and exposure therapy actually isn't fun at all. But you could use it for fun, and you could use it to increase pleasant activities and combat um, avoidance and not enough pleasure in your life. And for people that are depressed, they often stop doing pleasant activities. So you could add it maybe as something that's fun to do. But I do want to emphasize that the way that we're using it right now is not fun. Maybe for psychoeducation or something, we could make it fun, but there's not the kind of people. There's not the gaming component into it right now.
Right.
Yeah.
Okay. Again, I won't probe too much because,
Okay.
yeah.
And
um,
exposure therapy is not fun. If anyone's done exposure therapy, they know it's not fun. But
right.
it's very effective. But it's
Yeah.
like chemotherapy. Yeah.
Okay. Okay.
Yeah.
I think that's a great place for us to wrap up. It's been a fascinating 30-minute journey. I'm sure that we'll probably get a lot more questions coming our way. So maybe we do another follow-up later on. But if anybody's actually wanting to read a little bit more about your work, where's the best place for them to go and do that?
Yeah, I guess on our website, on the website at Stanford. Unfortunately, I'm not publishing as much as I should. I've got about like 4 different papers I'm working on, but and I don't know, for the lay person, there's not really a lot out there. But you could go to our website at Stanford and just look up my name, Kim Bullock, Stanford, and there's papers and clinic descriptions, and we have an FND program, and you can look under our FND program that has some information. But yeah, this is still in very early phases, the virtual reality, so it's still very preliminary.
Yeah. So keep watching this space. We'll see
Yeah,
what happens over the next 12 months, but it's
yeah.
exciting times. Kim, thank you so much for taking the time out of your day today. Really do appreciate it. And look forward to speaking with you again soon.
Yes. Thanks for what you do. Yeah.
Thank you. Okay. Bye-bye.